Heart disease, a life-threatening form and how to prevent it. Heart disease refers to a group of conditions that affect the function of heart and blood vessels, which are vital against for sustaining life. The heart pumps blood to all parts of the body. If the heart malfunctions, it impacts various body systems and can even be fatal. Heart disease is a leading cause of death worldwide, including in Thailand. There are many types of heart disease, but the most common and dangerous include coronary artery disease, caused by the accumulation of fat and plaque in the arteries, supplying the heart. This narrows the arteries, impeding blood flow, leading to heart ischemia and potentially acute myocardial infarction, heart attacks. Arrhythmia occurs due to abnormalities in the heart's electrical system, causing the heart to beat too fast, too slow, or irregularly. Heart failure, a condition where the heart cannot pump enough blood to meet the body's needs, leading to symptoms like shortness of breath, swelling, and fluid in the lungs. Cardiomyopathy, a condition where the heart muscle becomes weak, abnormally or enlarged, reducing the heart's pumping efficiency. Congenital heart disease, structural abnormalities of the heart present at birth. Causes and risk factors. The primary causes of most heart disease are linked to unhealthy lifestyle choices and certain underlying medical conditions. Key risk factors include high blood pressure, forces the heart to work harder and damage blood vessels. High blood cholesterol, especially high levels of bad cholesterol, LDL, accumulates in the blood vessels. Diabetes, damage blood vessels and nerves that control the heart. Overweight or obesity increases the heart workload and raises the risk of other diseases. Smoking, chemicals in cigarettes damage blood vessels and increase blood pressure. Excessive alcohol consumption harms the heart muscle and raises blood pressure. Lack of physical activity weakens the heart and increases the risk of obesity. Stress triggers the body to release hormones detrimental to the heart. Genetics. If there is a family history of heart disease, your risk increases. Increasing age. The risk rises with age. Gender, men tend to have a higher risk than women before menopause. Symptoms to watch for. Heart disease symptoms can vary among individuals and types of disease, but there are general things to be aware of. Shade pain may feel like tightness, discomfort, and pressure, especially in the center of shades. It can radiate to the left arm, neck, shoulder, and back. Unusual shortness of breath. Difficulty breathing even with minimal activity or at rest. Irregular heartbeat. Palpitation affects strong or skipped heartbeat. Fainting or dizziness or feeling lightheaded. Swelling the legs, ankles, and feet due to the heart's inability to pump blood effectively. Other symptoms such as excessive sweating, nausea, and vomiting. If you experience these symptoms, especially severe chest pain lasting more than 2-3 minutes, seek immediate medical attention as the could be sign of acute heart attack. Prevention and heart health care. Preventing heart disease is paramount, focusing on adopting healthier lifestyle habits. Eat a healthy diet. Emphasize fruits, vegetables, whole grains, and lean proteins. Reduce high salt, high sugar, and high fat foods. Exercise regularly, at least 115 minutes per week of moderate intensity exercise, such as brisk walking, jogging, or cycling. Maintain a healthy weight, reduce the rate of obesity and its complications. Quit smoking and limit alcohol consumption to reduce risk to blood pressure and the heart. Manage stress through appropriate methods like yoga, meditations, or relaxing activities. Undergo regular heart check-ups, especially monitoring blood pressure, cholesterol levels, and blood sugar. Take prescribed medications if you have underlying conditions like high blood pressure, diabetes, or high cholesterol. Take your medications and follow up with your doctor regularly. Heart disease is a sure trait that can be prevented. Taking care of your heart health starting today will help you maintain a good quality of life and stay away from the risk of severe disease in the long run.